What I want you to do is to sit up reasonably straight. If we can straighten you up, Barry. The functions of the nose for an asthmatic, all asthmatics need to nasal breathe. If we have our mouth open, we're bypassing the filtering mechanism of the nose. Our nose is very, very effective at filtering incoming air. It removes 3/4 of germs and bacteria. It moistens incoming air. It warms incoming air. It regulates volume. And furthermore, if you have your mouth open, it looks dreadful. What I want you to do is to make the switch. If you've got a congested nose, and how do we decongest it? And we'll use this exercise here. Now, basically what I want you to do is to take a small breath in through your nose, a small breath out, hold your nose, and nod your head up and down for as long as you can. So that's a small in, small out, hold your nose, and nod your head up and down for as long as you can. Now, this exercise is very suitable for people who don't have contraindications. If you're a very severe asthmatic, I don't want you to push it too much, okay? When we've done it, I want you to wait then about 30 seconds to recover your breathing, and we'll start again. So we'll do it about 5 or 6 times. Try not to blow your nose at this point as well. Now, you might also start to feel warm, and the reason that you're feeling warmer is because when you hold your breath, you're building up CO2 in the lungs, it's building up in the blood, and it works to act as a natural relaxant of your blood vessels. This exercise is also quite effective for shifting mucus. You might find that you're shifting some mucus afterwards. If we can try it again, take a small breath in through your nose, small breath out, hold your nose, and nod your head up and down for as long as you can, up and down, up and down. And don't let any air sneak in and out of your mouth. So you're pushing it, you're holding it for as long as you can. And we'll keep doing it until your noses are free. This will work for the vast majority of asthmatics. It's only in the event that you may have a polyp or a deviated septum that you'll find it quite difficult to shift. But if there's inflammation or rhinitis, it will work pretty quickly. Any asthmatic, you can unblock your noses in 5 minutes. Now, this will work temporarily. This is about correcting your breathing volume. Other exercises, what we'll do is, by building up your control pause, your nose will remain free on a continuous basis. If we can wait just for 1 moment, you might start to feel some freedom coming in there now. You might start to feel warmer. If we can try it again. Take a small breath in, small breath out, hold your nose, and nod your head up and down for as long as you can. And I need you to push. Hold your breath for as long as you can, up and down, up and down. That's it. So the aim is to hold your breath for as long as you can, as if you're underwater. We all know that swimming has been quite beneficial for people with asthma. When we're swimming, our face is submerged. This is pretty much in the same guidelines. We're doing some physical movement, and at the same time we're holding our breaths. Now what I want you to do is to keep your mouths closed. If you've had your mouth open for the last 10, 15, 20 plus years, you might feel that as soon as you close your mouth, you might feel that you're suffocated, that you're not able to get enough air in. This is only a temporary measurement. For instance, you feel suffocated. Now I want you to continue to keep your mouths closed. If you were weighing 25, 30 stone, and you were eating 10 meals per day, and you suddenly go from 10 meals per day, somebody says to you, you're eating far too much. I need you to bring your food amounts, the amount of food that you eat, down to 3 meals per day. How will you feel for a few days? You will feel a hunger for food. And the reason you feel a hunger for food is because you've developed a habit of eating 10 meals per day. And this may have happened over many years. Now all of a sudden, if you go from 10 meals per day down to 3 meals per day, your body has become used to eating 10 meals per day. You're all of a sudden eating 3 meals per day, but your body is telling you you're not getting enough food, even though you're getting more than what you require. Our asthmatic, having the mouth open, Brian with his mouth open for, we'll say 8 years, I'm not quite sure, 11 years. So he hasn't had his mouth open for quite a while. He's become used to large volume breathing. Now with his mouth closed, just as for many of you in the past, you feel you're not getting enough air. But we keep our mouth closed and that feeling goes. Can we practice that exercise again? We want to keep doing it until our nose gets free. If we take a small breath in, take a small breath out, hold your nose, and nod your head up and down for as long as you can. Up and down, up and down. Again, the similarities here of swimming would be physical movement by moving your head up and down, accompanied by breath holding or restricted breathing. During the breath hold, you're building up CO2, and this is acting as a natural decongestant. Does your nose feel any freer? Is your nose 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 freer?
Yeah.
Okay, we'll wait 30 seconds and we'll do it again. Now, if I see you with the mouth open, I'm going to gently remind you. So, mouths closed, everybody. When should we have our mouths closed? For the rest of our lives. If we've got asthma, we cannot have our mouths open. Our mouths should be closed all the time, every minute, every hour, every day. As opposed to the noisy breathing with the mouth open and the sighs, lots of movement. Asthmatic breathing should be quiet, calm, still, regular, easy, and relaxed. When it's quiet and still and relaxed, we're not feeding our symptom. When it's heavy and there's upper chest movement and there's the mouth open, you're feeding your symptoms. You're contributing to your airway constriction all the time. Can we try that exercise once more? This again is the exercise to unblock the nose, and you keep doing it until your nose is free. Take a small breath in, small breath out, hold your nose, and nod your head up and down for as long as you can. So the aim here is to push. Now, if you do have contraindications, as mentioned in the manual, go gently with this exercise. You're better off using exercise number 6. But the aim here is everybody here is healthy. There's no blood pressure, no diabetes, no other conditions, just asthma, so we can push. Okay, so you're holding your breath for as long as you can. Okay,